So I'm Nichola Durham, I work for Bristol Wellbeing Therapies and I'm a trainee psychological wellbeing practitioner. I think it's got to be seeing people progress through treatment, so seeing people come in quite a difficult position, struggling even sometimes to get to work, and then through the course of treatment actually seeing quite a lot of progress and enabling them to become their own therapist and put those things in place at home. It's really nice to see. So initially you'd have kind of a up to 45-minute telephone assessment with somebody like myself, and then it'd be looking at kind of what your main difficulties are and what sort of treatment would best kind of work with those sort of difficulties. So we work with cognitive behavioural therapy, which is a evidence-based treatment, and we offer that in a couple of ways. So part of it is looking at psychoeducation groups and booking people onto those courses, and that's very much about kind of teaching people tools and techniques over a 6-week period. You kind of going away, trying those out at home over the week, coming back, us problem solving anything that might have come up over the weeks. Obviously not everybody wants to attend a group, so we do that over kind of one-to-one sessions as well. So up to 6 weeks, not everybody needs 6 weeks, but again it's about using those CBT techniques to help people put those things in place at home. So it might be if we were working with low mood, for example, we'd use a treatment called behavioural activation, which is about looking at what people are already doing in their week and trying to get a balance of activities across their week, getting them to do a little bit more. Or if it was things like anxiety, then it might be either kind of gradually getting them back to the situations that are triggering their anxiety, or just doing some really kind of basic psychoeducation around what is anxiety, what is kind of the fight or flight response, and breathing techniques and that sort of thing. I think the first one would definitely be short term. So people often come with a expectation of wanting support over quite a long period of time, because that's what's kind of portrayed in the media, whereas because we're working with evidence-based treatments, we're working over a much shorter time frame, so kind of 6 weeks or 12 weeks at maximum. And because it's evidence-based and it's about teaching you tools and techniques, we find that actually that tends to be enough time to teach you those techniques. So I think short term would definitely be the first one. And then collaborative, so that's a really important part of any sort of treatment. You know, it's no good if somebody comes in for an assessment with us saying to them, well, this is what I think you should do, because chances are you're not going to want to do that if we haven't talked about it or come to a joint decision. So working collaboratively is really important. And I think the last one is probably evidence-based. So everything we do is kind of a nice guideline, CBT-based treatment, because that's what's proven to work. So our main base is Lawrence Weston Clinic in North Bristol, and we also work out of Southmead Hospital and also down in Hartcliffe, so South Bristol. So we don't run courses out of Hartcliffe because we don't have a group room there, but we do run courses out of Lawrence Weston and Southmead in the daytime and the evening. And we also work with we're part of the any qualified provider system, which means that we work with a lot of different services throughout Bristol, so places like Oasis Talk based in the city centre, Connect Psychology, Second Step, and they all offer courses as well. So while we only work out of those 3 bases, we actually work as part of a much bigger system and can offer courses all over Bristol and South Gloss. I think we're a really easy access service. You know, people don't have to go to their GP, they can just give us a call. Everything, you know, is kept confidential within the NHS. We won't share anything with anybody else unless kind of risk comes up, for example, in which case we do have to share with the GP. But people can just give us a call. They can even give us a call in their lunch break at work to get registered with the service, and then it's really easy to get booked in for an assessment. And then again, it's so easy to get booked in for either a course or get put on a wait list for some treatment. So I think it's got to be that face-to-face contact with people, whether that be in a one-to-one setting or whether that be, you know, when I'm running my anxiety group at Southmead in the evening. It's just so nice to see people come each week, put the things in place and see the changes that they're making, but also notice kind of how they change, even just their presence in the room. If you're working with somebody with low mood, they can go from being quite subdued and quite upset in the initial sessions to changing quite a lot of that in such a short space of time, and that's really lovely to see.